I'm Alan Dale from Gale Force Winds, and I want to tell you, I'm having a great time here at Computek in the beautiful city of Toronto, Ontario, getting to meet some really cool people that are doing cool things. Why don't you introduce yourself? Tell us what you do.
Sure, Alan. Thanks for having me here. I'm Varshini. I'm a Medical Office Administrative Instructor at Computek College.
Tell me about that course. What's involved in that course?
In this course, we usually teach students about the Canadian healthcare system and prepare them to work for both administrative side as well as medical side.
Wow, that's a fairly complex world right now, the Canadian healthcare system, so it must require you as an instructor to be very innovative and creative in how you do business.
Of course, yeah. So in this case, we have to teach the students to learn software for billing, as well as teach them to take vital signs. Both are two different extreme things. So vital signs in a sense that it involves taking blood pressure, height, weight. Whenever you go to a clinic, they usually ask you to do everything. So we prepare them for both. So these students get job opportunities in administrative skills as medical assistant, as well as when they get to work in a hospitals or clinic, they get to work as a medical office administratives. So this course covers all kind of aspects in medical office. Yeah.
Is the course offered in person, online, or is it a hybrid solution? How does that work?
It's hybrid, but after the COVID, 99% of the time is online. But for practicals, they do come to the campus.
Okay, so they have to come, obviously, to come to the campus and learn those practical skills.
Yes, to taking vital signs and all that, yeah, hands-on. Yeah.
Tell me the importance of experiential learning, so the actual ability to touch things and be involved in it. Talk about that.
Yeah, so here, these students that I teach, when they start working in a hospital or clinic, they will be dealing with patients. So they have to develop the empathetic skills, as well as they will be, there is a lot of confidentiality involved as well. So when they come to the campus, we guide them how to take patients to the room. We have a patient rooms and we have all the resources at our college. So we take them how to take the patient inside the room, get consent before we touch the patient to take blood pressure or any other vitals. So that's how we groom these students.
Right.
Yeah.
You know, there's all of the folks that I've spoken to here already, they refer to Computek as home. This is the word they use. It's home and a family setting. Tell me about the importance of making the students feel welcome like that.
Yeah, so definitely being an instructor by myself, I also feel that this college, I feel like a home. But for the students, definitely, because the students that I teach all are mature students, and they wear different hats. So we just try to connect with the students and try to understand their level and go to that level to teach them. So maybe that's how they're able to connect to us.
Yeah, that sounds like you're more than instructing them. Would it be safe to say that you're empowering them?
Absolutely, 100%, yes.
Yeah, and there's a difference, right? I mean, there's one thing to instruct somebody, there's another thing.
Preparing them for a life, yeah. That's what we do. Yeah.
Yeah, it's an all-encompassing sort of approach, isn't it?
Yeah.
The other thing I wanted to talk about is it's one thing to take the students in, prepare them for learning, which they do very well here. Take all those barriers down to make sure that the students are ready to come in and learn. Put them in front of people like you who have industry experience, and then ensure they're successful at the other end. Talk to me about the importance to preparing the students to go to the job market.
Yeah, so I had students, a single mother who has 4 kids, and she had a hard time managing home and then the studies. But we were able to balance it out, and now she's working at Stouffville Hospital as Medical Office Administrator. So we have multiple students, single mothers, and also newcomers. We deal with a lot of newcomers who are very new to the healthcare system. So they also, when they call me and tell that they get a job at this specialty clinic or pediatric clinic or hospital, I feel that I did my job good. So, yeah.
Yeah, that's what you just described to me, and in particularly those examples, what you've done there is you've changed lives.
Of course, yes.
Yeah,
that's what we do, yes.
That's a whole different thing than teaching and letting people graduate, isn't it?
Yes, so usually we say that education is a passport to your future. So that's what we are doing, preparing them and giving them the passport.
Tell me what the students mean to you.
Students, I feel they are my children.
Yeah. You must feel every day you go to work, you can't wait to get into the conversation.
So usually my students, most of my, 80% of my students are age-wise more than my age, but they tell me that I treat them like a mother. I always have that mother instinct towards my students. So, yeah.
It must feel great.